morning. Thank you very much for the invitation. And I invite all of you to look at our website. That is the Brazilian magazine of Sociedade Brasileira de Quadril. And that guy, once I showed to my mother, she thought it was me, but it's not me. It was John Chandler, which happened 2 years ago. He was the man who transformed hip surgery. I have no conflict of interests. And all my lectures, I thank very much Jorge Cruz de Mello, Manuel Padim, Fernando Leal for inviting me here. It's the fourth time I'm talking, and all these lectures you can see in the website. If you put Lafayette Lage, Manuel Padim has a spectacular lecture on preparation for hip arthroscopy, and all these other guys. Even a lecture that Luis Pérez Carro invited me to talk about osteonecrosis in Santander, which is very interesting. Osteonecrosis, hemisphere resurfacing for osteonecrosis might be a good option for very young patients. I won't read all this, but the fathers of my fathers are from this region, Porto and Vila do Conde. And he was the first orthopedic resident in Brazil, and he had 5 children. I'm the youngest of them. 4 of us are doctors. And then I married with Lilian, who is a dermatologist. My son is in the 2nd year of residency in orthopedics. And I did a master's in hip arthroscopy between 1991 and 1996 in Brazil. I visited Dr. Villa in 1993, and I started doing hip arthroscopy. And I was the only one to do it between 1993 and 1996. And Jorge Cruz de Mello likes to say that life is a path. And coincidentally, I learned how to write by this book, which is called Caminho Suave, soft path. But we know that nothing path. What soft is, water, sand is soft. Is soft. But our life, we need to study to be up to date. So the learning curve of any surgery needs dedication, continuous education, good technique, good equipment, the right indication, and mainly the right patient. So in 1993, when I started doing hip arthroscopy, I published this paper in 1995, Indications and Technique, a Revista Brasileira de Ortopedia. Then in 1996, the importance of the acetabular labrum, and also the classification of the labrum tears. That was in 1996. And at that time, we used to work only in the central compartment. And what we used to do is doing the debridement. The most indication at that time is doing debridement of osteoarthritis and also for diagnostic purpose. And we had good results. The pain relief that was for 3 months to 3 years, depending, because at the end of the surgery, you put corticosteroids. But then in 2003, things starts to be complicated with GANs, with the femoral acetabular impingement. Things start getting complicated, and then in 2015, Luis Pérez Carro, Fernando Leal, most things are getting more complicated. Then you have the sciatic nerve, and nowadays even more complicated. We see patients that are undergoing hip arthroscopy, and then you need to do the precise indication. And unfortunately, training like a course like this is very important. It's very important what you're doing, George, the Porto with this cadaveric, wonderful courses that we had. But it's very sad when I see, the thing that I see more often in my office is the patient who undergoes hip arthroscopy, then he says, the doctor said, I wasn't expecting your hip was so bad. This is so often, and it's becoming more and more often. Hip arthroscopy is a very difficult procedure. And now, you need to think about a new disease, the pelvic neurodysfunction. This is a Brazilian guy, Marcelo Lemos. He was graduated in São Paulo. Nowadays, he's the head of a university in Faculty of Medicine, University of Toronto in Canada since July 1st, 2023. So, pelvic neurodysfunction is another cause of pain. So, can a patient have pelvic neurodysfunction and deep gluteal syndrome? I think so. Or can he also have other problems, like he can have pelvic nerve dysfunction, he can have deep gluteal syndrome, he can have femoroacetabular impingement, he can have hemorrhoids, or he can have even a limb shortening. So to start the examination of a patient, you need to do what I call the magazine test. This is something I learned with my father, and I've solved dozens of patients with chronic pain, even head pain. You put a magazine in the floor and you ask the patient to stay in one side. The patient says, do you feel any difference? If the patient says, I feel more comfortable, then do the other side. No, this is not good result. So you don't need to do an X-ray. If the patient feels more comfort with a magazine, or maybe more, maybe you put a little bit more, maybe a little bit more, depending on the shortening. And this is what he needs. So you don't need to take an X-ray. But this can solve his pelvic problem, can solve his neck problem. So it's important. This test is very simple to do. I have my YouTube, this testimonial of this mother who took her child for more than 20 doctors. She was having pain for more than 2 years. She was 4 years old, and one of the doctors even said, maybe we need to do an MRI. Maybe your daughter might have a tumor somewhere. Imagine saying this to a mother. So, and then everything was solved. She had a 5 millimeters of short lengthening. Because you must remember that children also are born with the sciatic nerve. Another thing, this picture with Paulo Rego and William, 2 days ago at the dinner, we were together at the dinner, and we are great fans of crutches. This is a patient here who showed me this patient on the right. He's walking 7 days post-op of a resurfacing. Then he sent me the picture showing, see how good I am. I said, no, you need to keep your crutches. You need to keep your crutches. Then another example, this guy had a resurfacing 8 years ago, and then 5 days later he came to my office to change dressing and was wanting to walk without crutches. Again, no, crutches are very important. We need to stop this fast track. Fast track is good for Disneyland, to go to Universal Studios, so you don't have to stay in line. Fast track in orthopedics has no sense. These are the best friends for us orthopedics. Crutches. Why? They allow soft parts healing and also prosthesis osseointegration. It helps prevent osteoporosis before surgery. It helps prevent osteoporosis. It helps, does mechanical stimulus, relieves pain, do no harm to your kidneys, to your son. So in my office, I buy like dozens of them. The patient never wants to buy those. You need to teach. Those are the ones I prefer. The Canadian articulated crutches. So I teach them, I give to them. It's included in the consultation because they don't buy it. But then when they find out the use of it, and also it protects you from other persons. I tell the patient, the car stops for the crutches. The car may pass through you. People are more gentle with you if you use the crutches. So prescribed crutches is a good thing. As I said, as a curious, 33 years ago, I visited Harlem Amsterdam. I was also in his ass in the same year. In the same year, I visited Richard Ville in Cambridge. And I think I'm the right way. You need to do what you think is right. And Amstutz is one of the founders of metal resurfacing. And this lecture was done last year in New York. These 4 guys, this guy Thomas Gross has more than 7,000 implanted, Makining more than 10,000 implanted. And now they are coming, the metal poly, the Cera, but if you read this paper we published in Hip Resurfing, Hip International, we have 11,382 prostheses with more than 90% of survival in young patients younger than 40 minutes. So, why discard so much bone? So, and finally, what I want to say is the resurfacing is, I think, is a good way to go. Although all the bad things that they say metal is bad, with my background, I can tell you it's a good thing. And so you restore. This patient lives here in Portugal, south of London, south of in Cascais, this guy is a professional dancer, this guy is a surfer, all of them young, doing their activities, coming to normal function. So if you can do this and give this to our patients, so take care of your patients' hip as they were on. Exactly 1 week ago I was playing soccer with 4 patients of mine. So I only have 320 cases, but I think you have to do what you think is right, and if you believe is right, and you have the ability to do. So take care of your patients' hip as they were your own. Another thing, if you see a mismatch, if you see a mistake, tell immediately. Don't hide anything for your patient. He trusts on you, and it's very important, you as a doctor, to be very reliable to him. Thank you very much.